Hello, my name is Bryson, and today we'll be performing a postpartum assessment on our new mother, Mary. She just recently had her baby yesterday. We're going to go ahead and go through the bubble he mnemonic, and we'll just go ahead and perform a good head-to-toe assessment on them. Hello, Mary. How you feeling? Feeling good? Okay. Well, my name is Bryson. I'm a nurse over here at St. Martin's. I'm going to do a quick head-to-toe assessment on you just to make sure everything's going good. Now, I already asked you how you're doing. Have you had a chance to bond with your baby? Have you gone skin to skin? That's good. Okay, perfect. And I see your husband's on the corner taking care of her. All right, perfect. And then he's being supported, all that stuff. Okay, perfect. Good to hear. Well, as I said before, we'll be performing a head-to-toe assessment on you. It's kind of a routine thing. We got to go ahead and just make sure everything's going good with you. We're going to follow the mnemonic bubble he. It's pretty much just kind of an outline to help us formulate how we're going to go ahead and assess you real quick. I will be touching your breasts, and I will be looking around your perineal area. Is that okay if I get a bit handsy to make sure everything's okay? Perfect. All right, let's go get some vitals started first real quick to make sure I had the same patient, Mary. Okay, it's good. All right, same. Please give me name and date of birth. All right, perfect. And make sure the bed's locked and everything like that. All right, we're good. Let's go ahead and get started on those vitals. Okay, do some blood pressure here real quick. All right, so your blood pressure is normal. We're looking at 118/70, which is normal within the first trimester. We're good with that. And we're gonna go ahead and take a listen to your heart rate. 80, within range, okay. And then your temperature is 98.6 degrees Fahrenheit. Okay with me, and respiration's at 18. Perfect. Okay, we're gonna start with the top half of you. I'm gonna just go ahead and take a look real quick, all right? Just take a look at your breasts real quick to make sure everything's running right here. Okay. Let's take a look. All right, so we're visualizing here. We see that you have everted nipples, which is totally good because you are breastfeeding. Any signs of just a little bit of a trauma to the nipples, but that's because your baby just started recently latching on. That's totally fine. I'm gonna go ahead and palpate around the areas to look for consistency and fullness. A little bit engorged, but that's totally fine because you are breastfeeding. And I note that there is a little bit colostrum coming out, which is a bit thicker than your normal milk. It is, but it is packed full of nutrients and antibodies that's useful for the baby to have. Just gonna keep looking around real quick. All right, we are all good with that. And I'm also taking a look at your skin real quick. I noticed that you are a bit red and pink and a bit warm, a bit diaphoretic, which is totally normal because your body does accumulate a lot of fluids as you are pregnant and you are delivering, and is expunging pretty much all the leftover liquids that it needed to help support you while you were pregnant and delivering. And I'm also going to take a look at your skin turd. Doing good. Do a capillary refill right it. Less than 3 seconds. Looking good. All right. I'm going to go ahead and take a look at your perineal area as well as your kind of your belly area here. It's going to expose you where I need to see you. All right. So I know you didn't have a cesarean section or a C-section, but I'm going to educate you on it anyways. So we want to make sure that if you did have one, you would want to make sure that the incision is patent and make sure it's clean and dry and there's no discharge coming out of it, no signs and symptoms of infection. And we want to go ahead and auscultate each quadrant of your abdominal area. And I also been meaning to ask, have you had any pain down here on your abdominal area? No? Okay. As I said before, yeah, we'd also auscultate each side of the abdominal area just to make sure everything's running good. And how long ago have you had a bowel movement? You haven't had one yesterday? Totally fine. That's completely normal within the first 24 hours of birth. Then after that, we'd also take a look at the, we'd also auscultate, not auscultate it, but we'll palpate around the area just to make sure it's not distended. And while we're here, we're also going to take a look at the fundus right here. It is located at the midline, which is totally normal. And as days go by, we'll go ahead and lower at least 1 centimeter down. And see here, it is a bit firm to the touch, which is totally normal. And I see you have a Foley catheter in, and you are at 45 cc, which is totally normal. And we'll go ahead and take a look at your locus, which is kind of like the redness coming out, or the little drainage coming out. I'm gonna go ahead and just slowly but a bit firm, I'm pushing. All right, your loci is rubra. That means it's just red. It's totally fine. The clot size is not that big. It's less than a golf ball. And have you been exchanging pads hourly? No? All right, that's good. All right, and there's no foul odor or anything of the sorts. All right, doing good, doing good. I'm going to cover you up real quick. All right, we're going low. We're going to move down to your legs. Make sure everything's working down here as well. And expose you real quick. All right, and I do notice that the skin is intact, warm to the touch, a bit diaphoretic, which is expected. Turgor's okay. We're gonna go ahead and just feel for a bit of edema. Any pain or tenderness as I press around right here? No. Other side. Okay. While we're at it, we're also gonna feel for your pita pulses. Make sure they're equal bilaterally, to which they are. That's good. Okay, I'm gonna go and lift up your legs real quick, and I'm gonna push back on the heel. Okay, no jittering. I'm also gonna push this back as well and feel the back of your calf. Do you feel any pain as I palpate around this area? No? Perfect. Same thing right here. No jittering. Push back, feel behind the calf. Any pain? No? Perfect. All right, now that we have you fully exposed, I'm gonna have you face this way real quick. Okay, slowly go to your side. I'm gonna check out the back side here real quick. We're gonna take a look here. We have a little mnemonic we like to follow called Rita. We're gonna look for any redness, any ecchymosis, any edema, any discharge, and any approximate location of any episiostomies and or lacerations, to which I don't think you have. Have you ever had a history with hemorrhoids? No? All right, perfect. Well, everything looks intact. Just a bit redness, but it's pretty much normal. All right, just gonna slay you back down real quick. All right, cover you back up as well. All right, so I already asked you about how you're doing with the baby, and if your husband's doing a good job with bonding and everything's going swell, that's good to hear. So I'm gonna go ahead and just go down a list of warning signs you need to keep part of or keep in mind of. So any pain in the chest, any shortness of breath and or obstruction while breathing, any signs or symptoms of seizures such as visual aura and or like visual changes, any thoughts of harming yourself and or the child. You also have any excessive bleeding, if the clot size is bigger than a golf ball and or you're changing out pads regularly, hourly. Also, as well as if you had an incision, you want to make sure it's properly healing as well. And any redness or swelling in your lower extremities, like your legs, you want to let us know that as well. Let's see here. And if your temperature exceeds more than 100 degrees Fahrenheit, or 100.4 degrees Fahrenheit, you want to let us know about that as well. And if you have a headache of any sorts that is not relieved by Tylenol, that's another thing you need to let us know. So any of those things you start to experience, just please let us know. We'll come take care of that for you, and then we'll do what we can for that. And I know you're eager to go back home, and I'm just going to go ahead and just give you some discharge information. So since you are breastfeeding, I think it's important for you to note these things I'm going to tell you. So engorgement is usually normal. Your breasts are going to hurt a little bit, and if they do, it's okay to go ahead and apply an ice pack to it. When it comes to breastfeeding, colostrum, as I said before, is a bit thicker than your normal milk. It is packed full of nutrients and antibodies that the baby needs. It's also good to have a well-supportive bra to wear. You want to wear it for 24 hours at least. I'd say a sports bra would be good to wear. And you want to make sure that when you do take showers, you want to keep water away from it, as well as don't use any soaps, because that could ruin any lateral lubricants that the baby needs to help latch on. Other than that, yeah, just if you feel pain, good old ice pack, cold compress would work, and just make sure you wear a supporting bra. Do you have any questions for me? Anything you want to note? Anything of the sort like that? No? Okay, perfect. All right, I'm gonna go and get you situated real quick. I'm going to lower you. All right, let's find the button here. Perfect. Now I'm gonna leave the call light right here next to you, and if you have any questions, please feel free to call us. We'll go ahead and get straight to you, okay? Perfect. All right, thank you so much, Miss Mary.